Every single year, millions of people save up thousands of dollars, go through complex surgery, and endure weeks of pain, all based on a simple promise that a dental implant will solve their problem for life. But for a terrifying number of them, that promise is broken. After a year, or maybe two, the complications begin. The pain returns. And sometimes, a second, even more expensive surgery is needed. This happens because they were never told the most important truth. Implants are not for everyone, and the difference between a lifelong success and a catastrophic failure is hidden in the details your dentist might not be telling you. In this video, I will pull back the curtain on the entire dental implant industry. We will go far beyond the sales pitch and discuss the unmentionable truths, the hidden science, and the absolute list of people who should never get an implant. This is the conversation you must have before you let anyone near you with a drill. 1. The hidden science. Your jaw's secret language. Before we even talk about implants, you need to understand why you need one. When you lose a tooth, you don't just lose a tooth, you lose the conversation. Think of your jawbone like a muscle. If you stop using a muscle, it shrinks. It atrophies. Your natural tooth root does something incredible. It constantly talks to your jawbone. Every time you chew, it sends tiny signals of force, telling the bone, "I'm here, I'm working, stay strong and hold on to me." The bone listens, and it stays dense and healthy. The moment that tooth is gone, the conversation stops. Silence. The bone in that area, receiving no more signals, thinks it's no longer needed. It begins to slowly melt away or resorb. This is called bone atrophy. This is the process that causes that sunken look, that makes your face look older, and that makes wearing dentures a nightmare. The problem isn't just the missing tooth, it's the dying bone underneath. An implant's real job is to restart that conversation. What is a dental implant? The three-part illusion. Most people think an implant is just the white tooth they see. That's wrong. A dental implant is a complex three-part system. If you don't understand the system, you can't understand the risks. Think of it like building a small house. Part 1. The implant. This is the part you never see. It's a small, medical-grade titanium screw that is surgically placed into your jawbone. This is the foundation of the house. It's designed to be the new artificial root. Part 2. The abutment. This is the connector. After the foundation is healed and stable, this small post is attached to the implant, sticking just above your gum line. This is the framework of the house, connecting the foundation to the visible structure. Part 3. The crown. This is the tooth part. It's the beautiful custom-made ceramic or porcelain tooth that you see and chew with. This is the house itself. The illusion is that the house is the most important part. The truth is, a beautiful crown on a bad abutment or a failing foundation is completely worthless. The success of the entire system depends entirely on that hidden foundation. The unmentionable truths. Your dentist hopes you don't ask. When you're in the chair, you're often told about the benefits, but you need to be prepared for the biological price you have to pay. This is what really happens. Truth 1. The time deception. You see marketing for teeth in a day. For most people, this is a dangerous fantasy. The single most important part of the implant process has a name: osseointegration. This is a slow, biological miracle. It's the process of your living bone cells, your osteocytes, literally growing into and fusing with the microscopic threads of the titanium implant. This process cannot be rushed. It is biology, not construction. It takes, on average, 3 to 6 months. If you try to put chewing force on that implant before it's fully locked in by your bone, it will fail. You must be prepared for a 3 to 6 month journey. Truth 2. The biological price. The swelling. This is surgery. We are placing a foreign object into your bone. Your body will react. You should be prepared for significant swelling. We tell our patients, on day 3, you will look like you lost a fight. This swelling is intense, it can be alarming, and it's often accompanied by bruising. This isn't a complication, it's the normal healing process. Your body is smart. It's sending a massive rush of blood, fluid, and immune cells, all the construction workers, to the site to begin repairs. This inflammatory response is what causes the healing. But you must be mentally prepared to look in the mirror on day 3 and trust the process. Truth 3. The temporary nightmare. The gap. So, you have to wait 3 to 6 months for the foundation to heal. What do you do about the empty space? Especially if it's a front tooth? You will not leave with your permanent tooth. You have a few options, and none of them are perfect. Option A. The gap. You simply go without a tooth. This is the best for healing, but the worst for your social life. Option B. The flipper. This is a temporary, removable plastic tooth that looks like a small denture. It's cosmetic, but it's clumsy. You can't eat with it, and it can put pressure on the healing site. Option C. The adhesive bridge. In some cases, a temporary tooth can be gently glued to the neighboring teeth. You must discuss this in-between phase with your doctor before the surgery, so you are prepared for the reality of your appearance for the next several months. The 5 reasons implants actually fail and how to spot them. Your implant has a 98% success rate if it's done perfectly on a perfect patient. Here is why the other 2%, and many more down the line, fail. Reason 1. The osseointegration gamble, the early failure. This is the rejection. It's not a true allergic rejection, but a failure to connect. Instead of your hard bone cells fusing with the implant, your body forms a soft, fibrous tissue layer around it. It's like trying to put a screw into wet sand instead of concrete. The implant never becomes stable. This is often due to the patient's compromised healing, a smoker, a diabetic, or the bone just not being good enough from the start. Reason 2. The hidden killer. Peri-implantitis, the late failure. This is the #1 enemy of dental implants, and the one you must fear. You can have a perfect implant for 5, 10, or 15 years, and then lose it to this. Peri-implantitis is like gum disease, but for implants. It's a silent, chronic infection of the gum and bone around the implant. Here's the deadly part. Your natural teeth have a defense system. They have ligaments and a blood supply that can fight infection. An implant is just a piece of metal in bone. It has no defense system. The infection, often caused by poor hygiene, can silently and painlessly melt the bone away from the implant threads. By the time the implant feels a little wobbly, it's often too late. The foundation is gone. Reason 3. The engineer failure, bad planning. Your dentist is not just a doctor, they are an engineer. Placing an implant is a game of millimeters. If the implant is placed at the wrong angle, or it's too big, or it's too small, or it's placed in mushy, soft bone, it will fail. It will put unnatural force on the bone, and the bone will give up. This is why you must demand a 3D CBCT scan. This is a 3-dimensional X-ray that lets the surgeon see your bone density, volume, and the exact location of your nerves. Placing an implant with only a 2D X-ray in 2025 is like trying to build a skyscraper with a napkin sketch. Don't do it. Reason 4. The patient factor, smoking. I have to be blunt. If you are a heavy smoker, you are setting your money on fire. Smoking strangles your blood vessels. It cuts off the oxygen and nutrients that your bone needs to heal and perform osseointegration. The failure rate for smokers is dramatically higher. You are paying thousands of dollars for a procedure you are actively sabotaging. Reason 5. The overload failure. This goes back to the teeth-in-a-day marketing. Your new implant foundation needs time to set. If a dentist places an implant and immediately puts a permanent crown on it, and you go home and eat a steak, you are wiggling that wet foundation. You are creating micro-movements that prevent the bone from ever grabbing on. Immediate loading can be done, but it is an advanced technique that carries a much higher risk, and it must not be for chewing. Why bother? The 3 life-changing advantages for the right patient. After all those warnings, why would anyone get an implant? Because for the right, healthy, non-smoking patient with a great surgeon, it is the closest thing to a miracle we have in dentistry. Advantage 1. It solves a one-tooth problem with a one-tooth solution. Before implants, how did we replace a single missing tooth? With a bridge. A bridge is a biological crime. To replace one missing tooth, we have to take 2 perfectly healthy neighboring teeth and grind them down to little nubs to act as anchors. You have just turned a one-tooth problem into a 3-tooth problem, all of which are now linked together and harder to clean. An implant leaves your healthy teeth completely alone. It is the single most conservative and correct solution. Advantage 2. It stops the facial collapse. Remember that secret conversation with the bone? The implant restarts it. As soon as the implant is integrated, every time you chew on that new crown, it sends those vital signals down the implant and into the bone. It tricks the bone into thinking the natural root is back. The bone stops resorbing. It stays strong and healthy. You are preserving your facial structure, your lip support, and your youthful appearance for decades. Advantage 3. The comfort of forgetting. A removable denture is a living prison. It clicks. It falls out when you laugh. You can't eat an apple or a steak. You have to take your teeth out and put them in a cup every night. An implant is fixed. It is part of you. You brush it like your other teeth. You floss it like your other teeth. And in 6 months, you will forget it's even there. That is the magic. The ability to eat, laugh, and live without thinking about your teeth. The Do Not Implant list. The 5 groups who must be cautious. This is the most important part of this video. This information could save you from a catastrophic outcome. There are certain groups for whom implants are an absolute contraindication. 1. The uncontrolled diabetic. If your blood sugar is not under control, your entire body is in a state of chronic inflammation. Your healing is severely compromised, and your risk of infection is massive. Your blood is sticky with sugar, and the healing cells can't do their job. You must have your A1C under strict control before even considering this. 2. Patients on bisphosphonate medications. This is critical. These are drugs, like Fosamax, often used to treat osteoporosis. These drugs work by stopping your bone from remodeling. They make the bone dense, but brittle and dead. If you try to place an implant in this kind of bone, it can't heal. It can lead to a horrific complication called osteonecrosis, where the jawbone literally dies and rots. You must tell your dentist if you are on these medications. 3. Active cancer patients. If you are currently undergoing chemotherapy or radiation, your body is in a state of war. Your immune system is compromised, and all your body's resources are fighting the cancer. Healing a dental implant is impossible. 4. Immunodeficiency conditions. Patients with conditions like AIDS or other severe autoimmune diseases that compromise the healing system are at extremely high risk for infection and failure. 5. Age, the young patient. This is the one that surprises people. We do not place implants on patients under 18, and sometimes not until 21. The human jaw is still growing into your early 20s. If you place an implant, a fixed concrete post, in a jaw that is still moving and changing, in 5 years, that implant will be in a completely different and very wrong position. The truth is, a dental implant is not a product you buy. It is a complex medical and surgical procedure. It's not for everyone, and it's not a shortcut. But now you are no longer a passive patient. You have the information that most people never get. You can now have an intelligent conversation with your surgeon. Ask them the hard questions. Ask them, are you planning this with a 3D scan? Ask them, what is your protocol for peri-implantitis? Ask them, what are my specific risks? This information is power, and now you have it. Please, share this video with anyone you know who is even thinking about getting an implant. You could be saving them from that second surgery and thousands of dollars in heartache. And in the comments below, I want to hear from you. What is the one thing you wish a doctor had told you before a procedure? Let's all learn from each other.